Good morning from Melbourne, and welcome to Professor Lewis Hsu. I hope I am pronouncing that correctly. It is a pleasure to have you on our second day of the inaugural Ask conference. It's a pleasure to have you on, to hear you speak. We want to hear all about the good news and the progress being made in sickle cell disease. And one thing that I saw about your biography is that you are passionate about finding cures for sickle cell disease. So I am really excited to hear your insights. Welcome.
Great. Thank you very much. So this starting off is just, I'm happy to take questions, probably put them in the chat. I won't answer personal health questions, and we can do that offline. And my personal email is there. Now, free medical advice is worth what you pay for it. But and so the title is that there's so much news in progress. How do we disseminate and implement change? And this is with my two roles, one as Chief Medical Officer for Sickle Cell Disease Association America, and the other as a Professor of Pediatrics and a doctor for children with sickle cell disease in Chicago. My disclosures are here. And what used to be is that all the sickle cell news was bad news, that this is a bad disease that affects every part of the body, that there are minority health disparities and inequities with stigma, with bias, with low funding compared to other genetic diseases, with a very uneven standard of care from one hospital to another, one country to another, no investments to develop better care. There was a rare disease that nobody knew about, and everything about sickle cell was fragmented and just bad, bad, bad. So all the news was like that. But I think that right now, and the other part of the bad news was there's a big burden, it's a big suffering and problem that people have to overcome to be able to get through this chronic disease and still attend school, be employed, plan for normal activities. And then when you get older, that there was all kinds of problems with different organs, and disability would start to really set in. And so there's a large set of bad news. But what I'd like to say is that now there actually is good news in sickle cell disease, that there's progress in treatments and cures. There's more educational materials available, more guidelines, and more public attention to racial inequities. Now, we have to start every discussion in sickle cell disease with showing some sort of picture of sickle cells under the microscope, and so that's here. And the classical understanding of sickle cell is that it was about these log jams of the blood cells that were becoming rigid, pointy, and getting stuck in the blood vessels. But now there's more understanding, so this is part of the good news, is that people understand more about what sickle cell disease does in the body, starting from the blood flow. So one high-tech version of this is illustrated through this website, rethinkscd.com. I'm not endorsing commercial products, just telling you that this is a really good animation showing how the blood cells can be elongated and stuck in the blood vessels as they try to get through narrow places, that the white blood cells get stuck, that the platelets get stuck, that there's clots, that there's stickiness of cells. But another way to look at it is with a low-tech way. And so one of the principles that people are finding is a problem in sickle cell disease is that the red blood cells, instead of being nice, squishy, spongy types of cells that can flex and turn through the blood vessels, they get to be dried and stiff and kind of brittle, sort of like a dried chili pepper. I like to eat chili. It's very exciting when you bite into it and all the chili seeds come out, and it's spicy, and you could also say inflammatory. It lights you up. And so when a red blood cell breaks and releases its contents, which is the hemoglobin, you kind of get the same effect. You get inflammation, you get reactive oxygen species. It can be very inflammatory to the body. And that's part of what the problems are in sickle cell, is from this release of hemoglobin, this hemolysis. Further, people have really come to realize that sickle cell disease is not just about pain, that there's other special health care that might be needed. watching out for infectious diseases, watching out for lung problems, for spleen problems, for stroke, for kidneys. And so there are special recommendations and care pathways now to try to deflect some of these or detect them early so you can do something about it. And more people are starting to have success at either early detection and early warning of organ problems or actually trying to fix them before they get to be very bad. And many of these are contained in guidelines, such as from the American Society of Hematology. So one of the first things at dissemination right now is that there are these guidelines that are trying to tell people what kinds of things to do. Another way to disseminate good news is through sickle cell centers. So this is a picture of parts of my sickle cell center where there are dedicated waiting room space. You can see the sign here says Sickle Cell Center Waiting Room. There's inspirational pictures on the walls. This lady was a big advocate for sickle cell in our state legislature, lobbied for all kinds of things and got us quite a bit of money and resources, and we mourn her passing. And then over here is the dedicated pain treatment area, so that this is a day hospital where people can come get pain treated for a few hours, 6 hours, 7 hours, by a specialty team that's really focused on sickle cell disease. And you can see this is a relatively quiet place compared to the usual emergency department. So you can have comprehensive pain treatment here as a way to get some things done. While you're here, you can also learn some of the latest events, news, handouts, and stuff like that about sickle cell. If you can pay attention while you're having pain, you can get some of that. There's news about hydroxyurea, about the medicines that can help to reduce the severity of sickle cell. And so you can see listings like this where we talk about what hydroxyurea is. There's more handouts. I think I saw that Agnes put one of those out as a major handout piece for the meeting. There's glutamine, which is a new medicine just approved in the US by the FDA in 2017. I think it's still making its way across the globe for approvals. But this is an amino acid, just part of the proteins that we eat, that's been purified, put into a powder packet that looks sort of like a hot chocolate mix type of packet. You put it on food or drink, and it helps to improve the red blood cells' antioxidant capabilities. Glutamine. There's two other medicines that have also been approved in the US by the Food and Drug Administration just before COVID hit. One is called voxelotor, brand name Oxbryta. This blocks sickling. It cuts down on this abnormal stickiness of the red blood cells. So red blood cells usually are smooth and glide through your bloodstream like through a Teflon tube. But part of the problem in sickle cell is that it can get sticky. You actually get a sense sort of like Scotch tape that you have adhesive on the surface of the red blood cells, making things sticky and not move so well. So instead of being like Teflon, it's more like Velcro, and it's just hanging up along the side of the blood vessel. The voxelotor is helping to block part of that. I'm sorry, the crizanlizumab, the next one here, is blocking some of that stickiness. The voxelotor is binding to the hemoglobin and blocking the sickling process from happening. So these two things work in different ways. So now we have 4 medicines that have actually been approved, and that's not all. So there's curative approaches now to sickle cell disease. On the left-hand part here is shown allogeneic bone marrow transplant. So having a bone marrow from somebody who's a donor for you, usually as a sibling, would be the best match. So this would be shown in the pink here. And that has been successful for more than 1,700 patients across the world. Success rates upwards of 90%. And my bone marrow transplant colleagues call this a happy transplant, that the chances of having problems is relatively low compared to the chances for cancer bone marrow transplants or other kinds of things. But what about those who don't have a bone marrow donor, the matched sibling donor? Well, now there's studies looking at alternative donors. Maybe it's a parent, maybe it's a sibling who's not a match, maybe it's even your child could be your donor. And finding ways to get around the immune system problems that can lead to rejection has become more and more successful. So it used to have success rates in the neighborhood of like 60%, but now the success rates are more than 80%, sometimes approaching the 90% levels for matched related donors too. But what if you don't even have those donors? Well, autologous transplant basically is now the thing where you can have gene therapy to fix your own stem cells. So you pretty much donate some of your own stem cells, put them in a bag. In the bag, they get treated with either gene transfer or gene editing processes that I'm going to go into very briefly. And these will now fix what's inside the stem cells so that the genetic message inside the cells is now going to make cells that don't sickle. Could be sickle trait or have high fetal or something, and they don't sickle anymore. Whereas the outside of the cell still looks like you, so you don't reject it. And so these kinds of news is still coming along, that you can have all these different kinds of bone marrow transplants. You can have this gene therapy. One way is with having a message, the genetic message in a viral vector that pretty much addresses it to the right area of this stem cell, the right part of the chromosomes, to put the message where it's supposed to be. That's one way to do gene therapy. And it can put in messages for anti-sickling hemoglobin or fetal hemoglobin, or change the regulation of your fetal hemoglobin. There's also gene editing, where the concept is sort of like a computer find cut type of function, that it goes very precisely to a certain sequence of DNA and takes it out. Now, sometimes it could put something in to replace it, or sometimes it just takes it out and allows it to patch up again. And you've made a change in the DNA without affecting any place else, just this one focal spot. So gene editing, and that uses techniques that go by names like CRISPR and zinc fingers. So there's all this progress. And how are we going to learn about them? Well, one way is with those guidelines as they are, which are large documents, 80-page documents. Another way is to put them into apps. Smartphone app called Ash Pocket Guide contains many, many of these things in a very concise bullet point type of way that you can carry on your own cell phone. And then they get updated when there's an update. You don't have to go find the latest guideline edition, because it's going to do it next time your phone updates. Another way to disseminate this information is with community health workers. So that community health workers can be able to tell patients, tell families, be where they are. And so this community health workers have been very successful in at least two of these settings. One shown as going to a rural village and meeting people under their tree, getting to know people, really being, instead of up in the office building and then sending a message to the village, you actually have a person in the village who talks about it. Or it could be in an urban setting on the sidewalk, really being where people are in the neighborhood. And this is somebody who can relate to the neighborhood better than me wearing a suit and a tie and stuff like that. May be able to come at different hours of day, or maybe it's somebody that you actually know the neighbors because you live kind of close by and you know Auntie Sarah and Uncle Kenzie and stuff like that. And you can talk to them because you really know them. So the social and cultural alignment. Another way to disseminate good news is with simple communication. So if I were to give you this information about what can trigger sickle cell pain in paragraph form, I would be writing probably 7 paragraphs. And I would try to tone down my medical jargon, but it's still 7 paragraphs of black and white text to read. What if I gave you this information instead as pictures? So now you can go boom, 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 boom. Here's 6 different ways to trigger sickle cell pain. Oh, I want to avoid these. I want to avoid exhaustion. I want to avoid dehydration. I want to avoid infection. I want to avoid stress. I want to avoid changes in the weather if I can, or at least dress for them. And I want to avoid extremes of temperature, such as I don't want to be right next to the air conditioner fan. I can at least sit 10 feet away from it so I'm not frozen on my skin. So this infographic approach is becoming very popular as a way to transmit information. We're trying to see how far we can push the infographic idea So here is a concise table that one of the medical students at University of Illinois Chicago has been working on for the summer. It's now in its 7th version of edits, trying to compare those 4 medicines I was telling you about. So I took slides and words, he made them into pictures and brought out some key ideas that patients might want to know about. First row is just their names and how there is a brand name and a generic name. The second row is what ages they're approved for. So you can notice that not everyone is available for every single age. So if I have a 7-year-old that I'm talking to in my clinic, I'm just going to concentrate on these 2 columns that are for 9 years and up or for 5 years and up. I'm not going to look at 12 years and up or 16 years and up, even though I had presented them on my slide deck. If somebody is thinking of getting pregnant or already pregnant, this tries to show this is not for you, hydroxyurea, not to take when pregnant because it's teratogenic. Glutamine, it actually has a safety record in pregnancy. Voxelotor, crizanlizumab has no safety record, has no track record, doesn't show harm, but it hasn't been really tested yet either, so not something we recommend. And it goes on. We're still trying to figure out how dramatic to make the infographic for the side effects, trying to tone this down a little bit maybe. But we also show, these 3 are oral. This one is given IV. These 3, 1, 2, and 4, take down the likelihood of pain in sickle cell. This one is acting in a different way, trying to increase hemoglobin. It may or may not decrease pain, but it can increase hemoglobin and probably improve your how pale your eyes are. So not so much jaundice, increase the hemoglobin level, probably also improve fatigue. And then all of these, because as I say, they act in different mechanisms, can be taken with hydroxyurea. So we're hoping to pack all this information in graphic form and distribute it. So this kind of picture could be sent by email, could be used in a clinic. You could send it maybe by WhatsApp to somebody. There's also things where good news is being spread by websites, downloadable resources. Job Accommodation Network, askjan.org, has a large document saying, if you are the employer of a person with sickle cell, here's some things you might want to think about as job accommodations, so you don't trigger problems in your employee or cause them to have to quit work because they're getting sick from their sickle cell. And this is because, why would you need this? Because not everybody knows about sickle cell. It's still a rare disease. Similarly, there's a whole set of resources at this website by my friends at Children's Hospital of Philadelphia, school action plans, or for camp too, summer camp, that these are things for a student to avoid, things for your teacher to know, things for your principal to know, to help keep the student as active as reasonably possible and not cause them problems. And some of these accommodations, either at school or work, could be a stool for rest, taking a load off your feet for a little while. If you're a cashier, maybe you don't have to stand for 8 hours. Maybe you could sometimes sit a little while and other times stand. This could help prevent perhaps exhaustion, could help prevent perhaps leg ulcers. Avoiding COVID and flu. This person with sickle cell, you can't really tell from the outside that they are immunocompromised, unlike a patient who's had chemotherapy and they're completely bald. You know that they had something bad happen to them, and they could get avoidance measures against COVID exposure, but the person with sickle cell might need a note from their doctor to do that. Flexible schedule, hydration and bathroom, temperature control. People with sickle cell know about this. The employer, the school may not know about it yet. And for an example, in my city of Chicago, there was discussion about how to better ventilate a school classroom. And could you do it by just, instead of spending the money to put in a heating and air conditioning system that's upgraded from when it was installed 50 years ago, why don't you just open the windows, have the kids wear hats and gloves and stuff like that, and they can have fresh air, and all the COVID-laden little particles in the air will get blown out into the environment. You don't have to worry about contagion. it's an okay idea in the warm temperatures, but in Chicago, it does get markedly cold. And so that would be not very good for all the students, but particularly bad for somebody with sickle cell. So we're trying to discourage the schools from having that as your solution for ventilation. Another way to disseminate information was visual arts and books. So there's this one artist named Hertz Nazaire painted this to say, this is what 10 out of 10 pain means for me. And this kind of picture has been used all through the world. Many, many people's talks have showed this as a way to clearly show the severity of sickle cell pain when you can't see anything from the outside. Humanities and arts are also being used in the form of books and illustrated books. So here's a nice coloring book that just came out. You can find this on the website. Here's a book that I wrote, Hope and Destiny, that also has a nice cover on it. And we have this young man who's showing off both his haircut and the book. And so having these kinds of ways to spread information, and now it's moved into more digital ways. So these are things that just came out in the last 3 months, I think. There was a competition sponsored by National Heart, Lung, and Blood Institute for students to make digital tools for education to help teens, family, friends, and schools understand sickle cell disease. First prize is taken by this thing called Game to Raise Awareness for Patient Provider Public, GRAPES, shown here. And it actually has a little game. Second prize is a book. Third prize is another game, and it's an app shown here. I think it's still in a beta version, but it's getting there. And then there was an honorable mention too. If people are interested, this QR code takes you there. And then there's things that are now being disseminated through strategic plans and trying to have white papers that are kind of like policy. So this one is it came from a US organization, the National Academy of Science, Engineering, and Medicine, but it really could apply in other places, including Australia or other countries, about building awareness, about having organized systems of care, strengthening the evidence base, increasing the number of health professionals who know how to provide sickle cell care, thinking about sickle trait, establishing and funding a research agenda. This is approximately 185 pages, this thing, but you can have it if you go to this QR code, this website through this QR code. There's also a highlights version and an executive summary for those who want to read less. But I think these are ways to engage lots of different parts of society in promoting sickle cell and sickle cell awareness. So in summary, talking very fast because there's been so much, there are new medicines that target this broader understanding of what sickle cell does to the body. It's not just the pointy cells, it's also sticky cells and vasoconstriction and hemolysis. There's new curative approaches with gene therapy as well as bone marrow transplant. And then there's new approaches to address these health disparities, including guidelines, blueprint for action, community health workers, infographics, apps, and other digital tools. And so the ways to disseminate is pretty much as many as you can think of. And there's great amount of hope on the horizon here. Here are some more resources showing you very fast. I do want to point out this Arise e-library is from an African project that I'm involved in. And so this has things that may not be so US centric as some of the things that have been coming out of my mouth. But a lot of the other things are kind of American. I'm happy to look for questions here. Don't see any so far.
Yeah, no questions so far, but Professor Hsu, that was a really great presentation. I mean, I'm just amazed. It really looks like a great, it looks like a great toolkit that is building up, and if that can be shared with many organizations across the world, because I can see that being used with in America or in Australia, and even in Africa. And one of the things that really picked my mind that I saw that I liked was that you really also focused on the cultural aspect of people being from from that particular community, also being involved in those outreach programs, because I think that's also very important, Yeah, no, and I obviously love pictures. I think for a lot of people, I'm a visual person, and I think a lot of people are. It would be good to have access to information that is so readily available in a summarized form, but it still tells you quite clearly what you need to know. I think it's a great effort. Yeah. Unfortunately, we have reached our time. We hope that you do interact with our app. We hope that there will be more questions for you to answer. But I'm definitely sure that as ASCA, we will definitely reach out for more collaborations. And we thank you generously for your participation in our conference.
Thanks so much. I wish I could have visited Australia, but next time.
Well, there is next year. So hopefully next year when we're all vaccinated and can travel, we definitely look forward to seeing you in person.
Yep. Thank you.
Thank you very much.